I'm standing outside the Marie Curie Hospice in Bradford, my home city. Since it opened in 2001, it's looked after thousands of local people and their families. We're going to take you on a guided tour so you can see for yourself the facilities it offers and get a flavour of this very special building. You'll meet a lot of staff and volunteers who help to make this hospice what it is, a place of great caring and support. All Marie Curie Cancer Care services are free of charge to its patients and their families and depend on the generosity of the public to fund their work. They provide the best possible care to patients and their families in a relaxed, warm and friendly environment. A number of services are provided, including complementary therapies, a day therapy unit and a 16-bedded inpatient ward. In addition, patients and their families are supported by a social work team, and spiritual support is offered to individuals of all faiths.
I'm Jane Edgley and I'm the hospice manager. I've been with the voluntary sector for quite some time, and they wanted somebody to commission a new build. So 9 years ago I actually helped with the commissioning of this brand new building. I think Marie Curie Cancer Care is vital in the provision of end-of-life care. There are lots of other people who do provide some of that care in hospitals and so forth, but we are a specialist unit here, and that is all we do, end-of-life care. I think locally we are Bradford's local hospice. Lots of people support us, and lots of the families actually come back year after year after they've lost somebody to either help with fundraising events or just to come and remember their loved ones. So I'd like to think that we treat the whole of the family and the patient holistically. So I think it is very important.
The kitchen is an integral part of the hospice, as it caters for everyone: the patients, the staff, the volunteers and the families of the patients.
My name's Irene Taylor, and I've worked here now for over 8 years, and I love every minute. It's wonderful. I think I've done every job here except the laundry.
My name's Lydia Lepp, and I'm the team leader in the day therapy department here at the Marie Curie Hospice Bradford. Well, day therapy really provides support for patients who want to be at home and are managing reasonably well at home, but may still have all the problems that patients who have palliative care needs have. So it enables us to actually look at the things that they may be struggling with and try and sort out some solutions to try and keep people at home as long as possible, so we give carers some respite when the patients come to us for the day. Because obviously if you're caring for somebody 24/7, you might run out of steam from time to time. So if there's somewhere safe where they've got access to consultant in palliative care, social workers, occupational therapy, physio, and all the nurses in my department are qualified nurses, so there's somebody who understands all their needs.
The day therapy unit provides many activities for all patients. A local artist visits twice a week to run a session for those who are interested in improving their skills or even just looking for an enjoyable pastime. The hospice specialises in palliative care for its patients. The staff here are dedicated to making the patients as comfortable as possible during their stay, and the personal needs of the patients are of paramount importance.
I'm Debbie Nyland and I'm a healthcare assistant within the hospice. Sometimes people can be here for quite a long time, so you have quite a lot of input, not just with them but with their families as well. you have empathy with people. Sometimes when people are upset and you see families upset as well, it can be quite upsetting. But we have a lot of support here.
Is it your first?
Yes, and I've been below for 2 weeks.
All right, so you won't know Christine then? Do you two know her?
No.
Yeah, she will. Yeah. Okay, Christine.
Well, I'm the senior doctor working here in the hospice, so I'm sort of responsible for their medical care overall. So what tends to happen is that I would see most patients quite soon after they're admitted, and then I would see them all probably once a week thereafter. Well, I think we're very fortunate in that we have a team of staff here who are very different in their training and their backgrounds, but people really respect each other's professions, perhaps more so than sometimes happens in other parts of the health service, and are prepared to spend time discussing patients and communicating well amongst ourselves about what care people need and how best to organise things for them. And I think patients pick up on that. I think they're aware of that as well, and the fact that we are fortunate that we're able to give people a bit more time often than they've been used to from the doctors and nurses that they've seen perhaps in the hospital setting.
And how long was it since you were first diagnosed?
15 months.
And how long have you been in the Marie Curie Hospice?
6 weeks.
And what's your opinion of the hospice in the 6 weeks you've been here?
Lovely. Can't see them improving any more than what they are. They're excellent. Oh, my eyes, when I came, because like I didn't know what to expect. I thought, well, doom and gloom, but it's totally the opposite. And the staff are brilliant. Can't do enough for you.
The medical staff at Marie Curie deal with the physical needs of the patient. But there are also members on the team who deal with their emotional needs.
I'm a member of the multidisciplinary team here, and one of the beauties of that is that we all work very closely together to look after the entire person. So if you're looking at the physical dimension of the person, psychological, the social support that person might need, and also, importantly, the spiritual support.
I do direct work with patients, so that's assessing their needs, identifying areas of work, meeting with family members, and again assessing their needs and looking at ways we can meet those needs. Also organise discharge planning, so people can get to where they want to be, whether that's to go home to die or to go home and live with some assistance from social services, home care for example. And then bereavement, so it covers across, and that's children and adults.
It costs over £2 million every year to run the hospice, and the fundraising team are instrumental in raising the majority of this total.
Well, I'm one of the fundraising team here, and our job really is to raise funds and to raise awareness of what the charity does to the people of Bradford. You know, we do local walks, we hold an annual daffodil ball, and we hope that people will, you know, sign up for a lot of these events. We also recruit people to give us their time, because we can't do without volunteers at all, can't fundraising, they really are a necessity. We like to feel that there's something for everyone, and as I say, people can't always give money, but we hope that they will give perhaps some of their time. It is vital, because we are a charity, we do receive some funding from the Health Trust, but we do rely on the community that we serve for support.
Hi, I'm Sarah Craven, I'm the physiotherapist here at the hospice. I started off small. I started with the sponsored walks, and then did a sponsored swim, and then got a bit more adventurous, and I did a zip wire, and then I did a tandem parachute jump from 10,000 feet, and then I trekked in the Sahara with a group of other people.
The Bradford Hospice is one of the newest, most modern of the Marie Curie facilities, with picturesque gardens, spacious ensuite bedrooms. The staff are highly experienced in dealing with their patients, and the whole Marie Curie team are dedicated to giving the best possible care to anyone who may need it.